Hello, this is a presentation of Holistic RI, a mind, body, spirit revolution. Today we are going to talk about high blood pressure, also known as hypertension. First, a disclaimer. This information is for educational purposes only. The information should not be misconstrued as treatment, diagnosis, or medical advice. I am not a doctor. If you have high blood pressure or a specific health concern, you should seek medical treatment for a medical provider. Diagnosis and medical management is extremely important. Lastly, unauthorized recording or distribution is prohibited. Hypertension and exercise. We know it's recommended, but how much and how often? Lifestyle modifications are recommended for all healthy persons to prevent hypertension. Stress and socioeconomic status are addressed in the ANCC's new recommendations, or the American College of Cardiology. Exercise can be beneficial in helping to reduce stress, reduce weight, and reduce blood pressure directly. Exercise has been shown to reduce blood pressure independently of weight loss, which essentially means that even if you don't lose weight through exercise, the exercise in itself is beneficial for reduction in blood pressure. These are the new American Heart Association blood pressure guidelines. So as you can see, even with normal blood pressure, the recommendations are healthy lifestyle improvements. It's important for prevention, which is obviously our ultimate goal. Many of us know that lifestyle modifications are recommended, but what exactly does this mean? Simply stating to exercise is vague and daunting at best. Too many choices can cause decision fatigue. So, how much, how often, and how intense? The intensity and duration of exercise is inversely related to overall mortality, meaning that the more intense and the longer the workout, the better the result for health improvement. As you would imagine, vigorous exercise has a profound impact on overall mortality. According to UpToDate, the benefits of exercise appear to be dose dependent, which means more is better up until a limit. Any exercise is profoundly better than no exercise. Even 2 75-minute sessions a week was still found to decrease mortality and cardiovascular disease. Again, just 2 sessions a week, 75 minutes each, has a large impact. Now, like I said before, the benefit stops after a certain point. So research has shown that the benefit of exercise plateaus at 100 minutes per day of moderate intensity physical activity in healthy adults. Evidence supports aerobic exercise to lower blood pressure as treatment or prevention of hypertension. The evidence supporting resistance exercise, unfortunately, is less compelling. Dynamic aerobic exercise is defined as the regular and purposeful movement of large muscle groups in moderate and/or vigorous activity that places stress on the cardiovascular system. Examples are brisk walking, jogging, dancing, bicycling, swimming, and utilizing exercise equipment such as elliptical machines and obviously a treadmill. Patients that are normotensive or hypertensive, meaning patients that have normal blood pressure or high blood pressure, should be advised to perform moderate intensity or vigorous intensity aerobic exercise. Now, bear in mind that this requires medical clearance. So prior to starting any moderate or vigorous intensity exercise, you have to be medically cleared first. And there is an algorithm involved in that process that your primary care provider or medical provider can help you figure out whether or not you are. They'll easily be able to let you know. So at least 150 minutes of moderate intensity is one of the recommendations, which breaks down to 30 minutes, 5 days a week. Another way is at least 75 minutes of vigorous intensity. So this is 30 minutes, 3 days a week. And these are the minimum recommendations to see cardiovascular health improvement. here's how you can figure out if this plan is working for you. So you come up with a plan, you figure out, okay, these are the recommendations. I prefer either vigorous or moderate, depending on, your preference, and find a plan. Figure out what that exercise is going to be, what days you're going to do it, and how does it work. And then you can use a weekly evaluation template to figure out what's working, what's not, and how can you stay on track. So number one, how do you feel about the past week? Number two, how do you feel physically, mentally, and emotionally? This can really help you hone in on maybe some of the benefits that you're not really thinking about. And that obviously helps motivation. Three, how has your energy level been? How's your sleep? How's your stress? Are you seeing any benefits in these areas yet? How has your personal schedule and your work schedule been? Meaning, are there any hurdles? Is there any adjustment that needs to be made? And then 5, app review. Some people use apps to help keep them on track. Is it useful? What are the stats showing? Or is it really just getting in the way? 6 is review your planner. Are you using a calendar? Is it useful? 7, identify barriers. 8, identify motivators. And 9, reevaluate the plan and switch it up as necessary. These are our references. Thank you for listening. This has been a presentation on hypertension from Carolee Nevelis, wishing you a happy heart and healthy poop. Visit holisticri.com for more information.